Here's something that terrifies every doctor, but they don't have time to explain during your 15-minute appointment. They are warning signs your body sends you every single day that could save your life if you recognize them early. But most people ignore these signs until it's too late, until they're in the emergency room wondering why they didn't see it coming. Stay with me until the end of this video, because I'm going to share the critical health signs that doctors desperately wish every patient knew. These aren't complicated medical concepts. These are simple things you can notice right now that could literally save your life or the life of someone you love. Let's get into the vital health signs doctors wish you understood. First, let's talk about your urine color. Most people never look at their urine, but doctors say it's one of the most important daily health checks you can do. Dark yellow or amber urine means you're dehydrated, which strains your kidneys and heart. Brown or tea-colored urine can indicate liver problems or severe dehydration requiring immediate medical attention. Red or pink urine could be blood, which might signal kidney stones, infection, or even cancer. Cloudy urine often indicates a urinary tract infection. Foamy urine can be a sign of protein leaking from your kidneys, an early warning of kidney disease. Your urine should be pale yellow like lemonade. If it's darker, drink more water immediately. If you see red, brown, or persistent foaming, see a doctor within 24 hours. This simple check takes 5 seconds and could catch serious problems early. Now let's talk about your bowel movements. Doctors wish everyone paid attention to this because it reveals so much about your health. Black or tar-like stools can indicate bleeding in your upper digestive tract, possibly from ulcers or even stomach cancer. This is a medical emergency. Bright red blood in your stool could mean hemorrhoids, but it could also signal colon cancer. Never assume it's just hemorrhoids without getting checked. Pencil-thin stools that persist for weeks can indicate a blockage or tumor in your colon. Very pale or clay-colored stools suggest liver or bile duct problems. Persistent diarrhea lasting more than a week, especially with weight loss, needs immediate evaluation. Floating stools that are greasy and hard to flush indicate fat malabsorption, possibly from pancreatic problems. Pay attention to changes in your bowel habits. If something changes and stays changed for more than 2 weeks, see your doctor. Don't be embarrassed. This information could save your life. Let's talk about unusual fatigue. Not just I'm tired, but I can barely function exhaustion. Extreme fatigue that doesn't improve with rest can be an early sign of heart disease. Your heart isn't pumping efficiently enough to deliver oxygen to your body. It can indicate diabetes. When your blood sugar is too high, your cells can't get the energy they need. It can signal anemia. You don't have enough red blood cells to carry oxygen. It can indicate thyroid problems. Your metabolism has slowed to a crawl. It can be an early warning of cancer. Your body is fighting something and losing. If you're so tired that you can't do your normal daily activities and rest doesn't help, see a doctor immediately. Get blood work including complete blood count, thyroid panel, blood sugar, and vitamin levels. Don't accept you're just getting older as an answer. Extreme fatigue is never normal. Now let me ask you something important. Have you been ignoring any of these warning signs in your own body? Please drop a comment honestly. Recognizing these signs early could save your life. If you're finding this information critical and potentially life-saving, I'd really appreciate if you could take just 2 seconds to hit that like button. It helps this vital message reach more people who need to hear it. Thank you so much. Let's talk about sudden swelling. If you wake up one morning and your face, legs, or ankles are suddenly swollen, this is not normal. Swelling in your legs and ankles can indicate heart failure. Your heart isn't pumping blood effectively, causing fluid to back up. It can signal kidney disease. Your kidneys can't remove excess fluid from your body. It can indicate liver problems. Your liver isn't producing proteins that keep fluid in your blood vessels. Facial swelling, especially around your eyes, can indicate kidney disease or a severe allergic reaction. One-sided leg swelling with pain could be a blood clot, which can travel to your lungs and kill you. This is a medical emergency. If you experience sudden, unexplained swelling, especially if it's one-sided or accompanied by shortness of breath, go to the emergency room immediately. Now let's talk about chest discomfort that isn't typical chest pain. Many people, especially women, don't get the classic heart attack symptom of crushing chest pain. Instead, they get pressure or fullness in the chest that comes and goes, discomfort in the neck, jaw, shoulder, or arms, unexplained nausea or cold sweats, unusual shortness of breath, especially with minimal activity, or extreme unexplained fatigue. If you experience any of these symptoms, especially if they're new or getting worse, call 911 immediately. Don't drive yourself to the hospital. Don't wait to see if it gets better. Heart attacks can present differently in older adults and women. Time is heart muscle. Every minute counts. Here's the critical truth doctors want you to understand. Your body talks to you every single day. It sends signals when something is wrong. The problem is most people aren't listening, or they dismiss the signs as just getting older or probably nothing. But doctors see patients every day who ignored these warning signs until it was too late. They see people who waited weeks or months to get that persistent cough checked, and it turned out to be lung cancer. They see people who ignored leg swelling until they had a pulmonary embolism. They see people who dismissed fatigue until they were in heart failure. You know your body better than anyone. If something feels different, if something has changed and stayed changed, if your instinct tells you something is wrong, listen to that instinct. See a doctor. Push for answers. Don't let anyone dismiss your concerns. Here's what I want you to do starting today. Check your urine color every day. Pay attention to your bowel movements. Notice if your energy level drops dramatically. Look for unusual swelling. Pay attention to any chest discomfort or shortness of breath. Keep a simple health journal. Write down anything unusual you notice. This information is invaluable when you see your doctor. If you notice any of the warning signs I mentioned, don't wait. Make an appointment immediately. If it's severe or sudden, go to the emergency room. If you found this information potentially life-saving, please subscribe to this channel. We share critical health information that doctors wish they had time to tell every patient. Drop a comment telling me if you've experienced any of these warning signs. Because your life is precious. Early detection saves lives. And knowing these signs could mean the difference between catching something early and facing a medical emergency. Alright, that's it for today. Pay attention to your body. It's trying to tell you something.